So good day everyone, we're from BSRT and today we're going to present a case study. So case study 1, Donna Stone was seen today by Dr. Ben White. Donna was previously seen 3 years ago for cholecystectomy. He referred her at that time to a surgeon for a cholecystectomy. She reports today that she has experienced dyspepsia for the previous 4 to 6 weeks and has had 2 recent episodes of hematemesis. Dr. White ordered an upper gastrointestinal series to be performed on Donna next Monday. So the question is, what was Donna's previous surgery?
So the Donna's previous surgery is a cholecystectomy or the removing of your gallbladder. So it's a surgical procedure to remove your gallbladder, a pear-shaped organ that sits just below your liver on the upper right side of your abdomen. Your gallbladder collects and stores bile, a digestive fluid produced in your liver.
What are Donna's symptoms?
Dyspepsia, indigestion, hematemesis, vomiting of blood. Hematemesis, vomiting of blood, also called hematemesis, is a serious condition in which blood is expelled from the mouth. The blood can be bright red, black, or dark brown condition that cause a person to vomit blood, can also cause blood to show up in the stool. Dyspepsia, also known as indigestion, refer to discomfort or pain that occur in the upper abdomen, often after eating or drinking. It is not a disease but a symptom.
What is a possible diagnosis for Donna's current condition?
So it is a peptic ulcer. So peptic ulcer is a disease occurs when open sores or ulcers, and it is formed in the stomach of first part of the small intestine. So many cases of peptic ulcer disease develop because of a bacterial infection. It's a way to protective lining of the digestive systems. And also, the most common symptoms of this disease or so-called peptic ulcer is uh, pain in the stomach.
Explain the diagnostic procedure that Dr. White ordered.
Procedure that Dr. White ordered is upper GI series. An upper GI series is a procedure in which a doctor uses x-rays, fluoroscopy, and a chalky liquid called barium to view your upper GI tract. The barium will make your upper GI tract more visible on an x-ray.
So the next case, we have a 60-year-old male goes to his urologist appointment complaining of painful urination. The medical term for this condition is dysuria. He also mentions to the doctor that he is frequently urinating during the evening. This is known as nocturia. Analysis of the patient's urine reveals the presence of red blood cells in the urine, which is indicative of a condition known as hematuria. Later that week, the doctor contacts the patient to let him know that inflammation of the bladder is suspected. This is termed cystitis. The other possible condition that the patient may have is the development of kidney stone, which is referred to as a renal calculi. So, dysuria is the medical term for pain or discomfort when urination, often described as a burning sensation. Dysuria most commonly is caused by bacterial infections of the urinary tract. What is Nocturia?
Nocturia or nocturnal polyuria is the medical term for excessive urination at night. During sleep time, your body produces less urine that is more concentrated.
Hematuria is a blood in the urine. When the urine is red or pink, this could be linked to blood in the urine and is called gross, gross or visible hematuria. As seen in the as seen in the screen, what this is what hematuria looks like. Sometimes blood is the urine, but is not easily seen and is called microscopic hematuria since it can only be seen under a microscope. What is cystitis?
So cystitis is a urinary tract infection or UTI that affects the bladder. And it's common, particularly in women, because women has is shorter urethra than men. And it often gets better by itself, but may sometimes be treated with antibiotics. So some people get cystitis frequently and may need a regular or long-term treatment. So here we have examples of uh, bladder having a cystitis. So as you can see in the left image, we can see the normal bladder, and the other side is the bladder having an inflammation.
What is the what is the cause of cystitis?
Cystitis is usually caused by bacteria from poo and getting into tube that carries urine out of the body. Women have a shorter urethra than men. This means bacteria are more likely to reach the bladder and cause an infection.
What is the difference between UTI and cystitis?
So, cystitis, a urinary tract infection, can be the same thing, but they aren't always. Cystitis is an inflammation of the bladder that can be caused by infectious or non-infectious reasons. UTI are infections of the urinary tract, including from the urethra to the bladder and to the kidneys.
What is an IVU?
So IVU or intravenous urogram or IVP, intravenous pyelogram. An intravenous urogram is a test that looks at the whole of your urinary system. It's sometimes called an intravenous pyelogram. It looks at this kidneys, bladder, tubes that connects the kidney with the bladder or the ureters.
So diagnosis. There are a few different ways to diagnose a urinary tract. So your doctor may ask for a urine sample to determine the cause of your symptoms. Your doctor may also perform a cystoscopy or an image test to determine the cause of your symptoms. So from the symptoms, dysuria, uh, it will be uh, a urinary test. So magkuha sila og imong urine. And for the Nocturia, it is like a diary. So it is a 2 days examination. Uh, kung unsay imong inom, kung kapila ka mga isa sa adlaw, it should be put there. And for the hematuria, a healthcare professional diagnosed hematuria with a urine test. So it's also a urinary test, urine test, I mean. And for the cystitis, it is also a urinary test and also performed in the cystoscopy. And for the renal calculi, it will be an imaging test. So it will be a computed tomography or the CT scan.
So the following are the possible treatments. Dysuria treatment is remove the stone. If sexually transmitted infection or STI, treat with antimicrobials. Uh, while Nocturia treatment is surgery or medical management in large prostate. Next, we have the hematuria treatment. It is a removing stone. If caused by tuberculosis, treat it using anti-tuberculosis medication. If it is caused by cancer, treat cancer either by surgery or chemo or both. Next, we have cystitis. Removed stone if due to parasite, treat parasite. If due to bacteria, treat it with antibiotic. Then we have the renal calculi. Remove the stone and use appropriate pH modifies as two type of stone. That would be our report. Thank you.